Anxiety disorders affect millions of people worldwide, impacting their daily lives and overall well-being. As mental health awareness grows, so does the importance of understanding effective treatment options. One such option that has gained prominence is fluoxetine, commonly known by its brand name Prozac. This comprehensive guide delves into the intricacies of using fluoxetine for anxiety, providing valuable insights for those considering or currently undergoing this treatment. Anxiety can manifest in various forms, from generalized worry to specific phobias. While occasional anxiety is a normal part of life, persistent and overwhelming anxiety may indicate an anxiety disorder. Fluoxetine, a selective serotonin reuptake inhibitor, SSRI, has shown promise in alleviating symptoms associated with anxiety disorders. By modulating serotonin levels in the brain, fluoxetine can help restore emotional balance and improve quality of life for many individuals struggling with anxiety. As we embark on this exploration of fluoxetine for anxiety treatment, it's crucial to approach the topic with an open mind and a commitment to understanding both the benefits and potential challenges. This guide aims to provide a comprehensive overview, from the mechanism of action to long-term considerations, empowering readers to make informed decisions about their mental health journey. Understanding fluoxetine and its role in anxiety treatment. Fluoxetine belongs to a class of medications known as selective serotonin reuptake inhibitors, SSRIs. These drugs work by increasing the levels of serotonin, a neurotransmitter associated with mood regulation, in the brain. By enhancing serotonin availability, fluoxetine can help alleviate symptoms of anxiety and improve overall emotional well-being. Originally developed to treat depression, fluoxetine has since proven effective in managing various anxiety disorders. Its versatility in addressing multiple mental health conditions has made it a popular choice among healthcare providers. The medication's ability to target both depression and anxiety is particularly beneficial for individuals experiencing comorbid conditions. When prescribed for anxiety, fluoxetine aims to reduce excessive worry, restlessness, and other hallmark symptoms of anxiety disorders. It can help individuals regain control over their thoughts and emotions, allowing for improved daily functioning and a higher quality of life. However, it's important to note that fluoxetine is not a quick fix and typically requires several weeks of consistent use to achieve optimal results. Understanding the science behind fluoxetine's mechanism of action can provide valuable context for those considering or currently using this medication. By blocking the reuptake of serotonin, fluoxetine allows this neurotransmitter to remain active in the brain for longer periods. This prolonged activity is thought to contribute to the medication's anxiolytic, anti-anxiety, effects. The journey begins. Starting fluoxetine for anxiety. Embarking on a new medication regimen can be both exciting and daunting. When starting fluoxetine for anxiety, it's essential to approach the process with patience and realistic expectations. The initial phase of treatment often involves a period of adjustment as the body acclimates to the medication. During the first week of fluoxetine use, individuals may experience a range of sensations and side effects. It's important to remember that these initial reactions are typically temporary and often subside as the body adapts to the medication. Common experiences in the early days of treatment may include mild nausea, headaches, or changes in sleep patterns. To navigate this initial period successfully, maintaining open communication with your healthcare provider is crucial. They can offer guidance on managing any side effects and provide reassurance about the treatment process. Additionally, keeping a journal to track your symptoms and any changes you notice can be helpful for both you and your healthcare team. It's worth noting that the full therapeutic effects of fluoxetine may not be apparent for several weeks. This gradual onset of action is a characteristic shared by many antidepressant medications. During this time, it's important to continue taking the medication as prescribed, even if immediate improvements are not noticeable. Dosage and administration. Finding the right balance. Determining the appropriate dosage of fluoxetine for anxiety treatment is a nuanced process that requires collaboration between the patient and healthcare provider. The goal is to find the optimal balance that effectively manages anxiety symptoms while minimizing potential side effects. Typically, fluoxetine treatment for anxiety begins with a lower dose, which may be gradually increased based on individual response and tolerability. This approach, known as titration, allows for careful monitoring of the medication's effects and helps identify the most effective dosage for each person. The standard starting dose for adults with anxiety disorders is often 20 mg per day, taken orally. However, this can vary depending on factors such as the specific anxiety disorder being treated, the presence of other medical conditions, and individual patient characteristics. Some individuals may require higher doses to achieve symptom relief, while others may respond well to lower doses. It's crucial to adhere to the prescribed dosage and administration schedule. Fluoxetine is typically taken once daily, often in the morning. Consistency in timing can help maintain steady levels of the medication in the body, contributing to its effectiveness. If a dose is missed, it's generally recommended to take it as soon as remembered, unless it's close to the time for the next scheduled dose. Navigating potential side effects. While fluoxetine can be highly effective in managing anxiety, like all medications, it may cause side effects in some individuals. Understanding and preparing for potential side effects can help patients navigate their treatment journey more comfortably. Common side effects of fluoxetine may include nausea or upset stomach, headaches, changes in appetite or weight, sleep disturbances, insomnia or drowsiness, dry mouth, sweating, nervousness or restlessness. These side effects are often mild and tend to diminish over time as the body adjusts to the medication. However, if side effects persist or become bothersome, it's important to consult with your healthcare provider. They may suggest strategies to manage side effects or consider adjusting the dosage. In rare cases, more serious side effects may occur. These can include allergic reactions, rash, itching, swelling, severe mood changes or suicidal thoughts, unusual bleeding or bruising, seizures, changes in heart rhythm. If any of these serious side effects are experienced, immediate medical attention should be sought. It's crucial to be aware of these potential risks while also recognizing that they are uncommon. Long-term considerations and maintenance. As individuals progress in their fluoxetine treatment for anxiety, long-term considerations come into focus. Many people find that continued use of fluoxetine helps maintain symptom relief and prevents relapse of anxiety disorders. However, the duration of treatment can vary widely depending on individual circumstances. For some, fluoxetine may be a short-term solution to help manage acute anxiety symptoms. Others may benefit from longer-term use to maintain emotional stability and prevent recurrence of anxiety. The decision to continue or discontinue fluoxetine should always be made in consultation with a healthcare provider, taking into account factors such as symptom severity, overall health, and personal preferences. Regular check-ins with your healthcare provider are essential during long-term fluoxetine use. These appointments allow for monitoring of the medication's ongoing effectiveness, assessment of any side effects, and discussion of any concerns or changes in your mental health status. It's important to note that abruptly stopping fluoxetine can lead to discontinuation symptoms, which may include dizziness, nausea, and mood swings. If discontinuation is desired, a gradual tapering of the medication under medical supervision is typically recommended to minimize these effects. Lifestyle factors and complementary approaches. While fluoxetine can be a powerful tool in managing anxiety, it's most effective when combined with a holistic approach to mental health. Incorporating lifestyle modifications and complementary therapies can enhance the benefits of medication and contribute to overall well-being. Regular exercise has been shown to have significant anxiety-reducing effects. Engaging in physical activity releases endorphins, natural mood boosters that can complement the action of fluoxetine. Activities such as jogging, swimming, or yoga can be particularly beneficial for managing anxiety symptoms. Nutrition also plays a crucial role in mental health. A balanced diet rich in omega-3 fatty acids, complex carbohydrates, and essential vitamins and minerals can support brain function and mood regulation. Some individuals find that reducing caffeine and alcohol intake helps minimize anxiety symptoms. Stress reduction techniques such as mindfulness meditation, deep breathing exercises, and progressive muscle relaxation can be valuable additions to an anxiety management plan. These practices can help individuals develop coping skills and resilience in the face of anxiety-provoking situations. Cognitive behavioral therapy, CBT, is often recommended alongside fluoxetine for anxiety treatment. This form of psychotherapy helps individuals identify and change negative thought patterns and behaviors associated with anxiety. The combination of medication and therapy can be particularly effective in achieving long-lasting symptom relief. Special considerations for different age groups. The use of fluoxetine for anxiety can vary across different age groups, each with its own set of considerations and potential challenges. Understanding these age-specific factors is crucial for optimizing treatment outcomes and ensuring patient safety. Adolescents and young adults. Fluoxetine is one of the few antidepressants approved for use in adolescents. However, its use in this age group requires careful monitoring due to the potential for increased suicidal thoughts, particularly in the early stages of treatment. Parents and caregivers should be vigilant for any signs of worsening depression or unusual behavior changes. For young adults transitioning to independence, medication management can present unique challenges. Establishing routines for consistent medication intake and maintaining regular follow-ups with healthcare providers are important skills to develop during this period. Adults. In adults, fluoxetine for anxiety is generally well tolerated and can be an effective long-term treatment option. However, considerations such as potential interactions with other medications, impact on sexual function, and effects on cognitive performance in certain professions, e.g., those requiring high alertness, should be discussed with a healthcare provider. Older adults. As individuals age, changes in metabolism and potential interactions with medications for other health conditions become important factors in fluoxetine treatment. Older adults may be more sensitive to side effects and may require lower doses. Regular monitoring of kidney and liver function is often recommended for this age group. Pregnancy and breastfeeding considerations. For individuals who are pregnant, planning to become pregnant, or breastfeeding, the decision to use fluoxetine for anxiety requires careful consideration and consultation with healthcare providers. The potential risks and benefits must be weighed carefully. During pregnancy, untreated anxiety can have negative effects on both the mother and developing fetus. However, fluoxetine used during pregnancy, particularly in the third trimester, has been associated with a small increased risk of certain complications. These may include preterm birth or neonatal adaptation syndrome, where newborns experience temporary symptoms such as jitteriness or feeding difficulties. For breastfeeding mothers, small amounts of fluoxetine can pass into breast milk. While the risk to the infant is generally considered low, monitoring for any unusual symptoms in the baby is important. Some infants may experience irritability, poor feeding, or sleep disturbances. The decision to continue, start, or stop fluoxetine during pregnancy or while breastfeeding should be made on an individual basis, taking into account the severity of anxiety symptoms and the potential risks of untreated anxiety versus medication use. Close collaboration with both mental health professionals and obstetricians is crucial during this time. Interactions with other medications and substances. Understanding potential interactions between fluoxetine and other medications or substances is crucial for ensuring safe and effective treatment of anxiety. Fluoxetine can interact with a wide range of drugs, potentially altering their effectiveness or increasing the risk of side effects. One of the most significant interactions to be aware of is with monoamine oxidase inhibitors, MAOIs, another class of antidepressants. Combining fluoxetine with MAOIs can lead to a dangerous condition called serotonin syndrome. For this reason, a washout period is required when switching between these medications. Other medications that may interact with fluoxetine include nonsteroidal anti-inflammatory drugs, NSAIDs, blood thinners, other antidepressants or anti-anxiety medications, certain migraine medications, some antipsychotic drugs. It's also important to consider interactions with over-the-counter medications and supplements. St. John's wort, a popular herbal remedy for depression, can interact dangerously with fluoxetine and should be avoided. Alcohol consumption while taking fluoxetine is generally discouraged. Alcohol can exacerbate the side effects of fluoxetine and may increase the risk of drowsiness and impaired judgment. Additionally, for individuals with anxiety disorders, alcohol can worsen symptoms in the long term. Always inform your healthcare provider about all medications, supplements, and substances you are using to ensure safe and effective treatment with fluoxetine. Monitoring progress and adjusting treatment. Effective management of anxiety with fluoxetine requires ongoing monitoring and potential adjustments to the treatment plan. Regular check-ins with your healthcare provider are essential for assessing the medication's effectiveness and addressing any concerns that may arise. During these appointments, your healthcare provider may evaluate symptom improvement, assess for any side effects, consider dosage adjustments, discuss any lifestyle changes or complementary therapies, address any questions or concerns you may have. It's helpful to keep a journal or log of your symptoms, side effects, and any notable changes in mood or behavior. This information can be valuable for both you and your healthcare provider in making informed decisions about your treatment. If the initial response to fluoxetine is insufficient, your healthcare provider may consider several options, Increasing the dosage, adding another medication to augment the effects of fluoxetine, switching to a different antidepressant or anti-anxiety medication, incorporating additional therapeutic approaches, such as cognitive behavioral therapy. Remember that finding the right treatment approach for anxiety can take time and may require some trial and error. Open communication with your healthcare provider and patience with the process are key to achieving optimal results. Overcoming stigma and misconceptions. Despite the prevalence of anxiety disorders and the proven effectiveness of treatments like fluoxetine, stigma and misconceptions surrounding mental health medications persist. Overcoming these barriers is crucial for individuals seeking help and adhering to their treatment plans. Common misconceptions about fluoxetine and other antidepressants include fears of addiction or personality changes. In reality, fluoxetine is not addictive, and its purpose is to help individuals return to their natural emotional baseline rather than altering their personality. Education plays a vital role in combating stigma. Understanding that anxiety disorders are medical conditions, much like diabetes or hypertension, can help normalize the use of medications like fluoxetine. Sharing experiences and success stories can also help reduce stigma and encourage others to seek help when needed. It's important for individuals taking fluoxetine for anxiety to remember that seeking treatment is a sign of strength, not weakness. Taking proactive steps to manage one's mental health is a commendable and responsible action. Looking ahead, future developments in anxiety treatment. As research in neuroscience and psychiatry continues to advance, new insights into anxiety disorders and their treatment are emerging. While fluoxetine remains a cornerstone in anxiety treatment, ongoing studies are exploring novel approaches and refining existing therapies. Some areas of current research include personalized medicine approaches to better predict individual responses to different anxiety medications, investigation of new drug targets beyond serotonin for anxiety treatment, development of faster-acting antidepressants and anti-anxiety medications, exploration of combination therapies that may enhance the effectiveness of fluoxetine and other SSRIs, integration of technology, such as smartphone apps and wearable devices, to support anxiety management and medication adherence. As these developments unfold, individuals using fluoxetine for anxiety can look forward to potentially more tailored and effective treatment options in the future. However, it's important to remember that current treatments, including fluoxetine, have helped millions of people successfully manage their anxiety and improve their quality of life. In conclusion, navigating the use of fluoxetine for anxiety requires a comprehensive understanding of the medication, its effects, and the broader context of anxiety treatment. By staying informed, maintaining open communication with healthcare providers, and adopting a holistic approach to mental health, individuals can maximize the benefits of fluoxetine and work towards a life less burdened by anxiety. Remember, seeking help and adhering to treatment are powerful steps towards reclaiming control over one's mental health and overall well-being.